So I'm a consultant psychiatrist and professor of psychiatry, and I'd like to talk today and shortly about erectile dysfunction, which might be the cause or consequence of depression or anxiety disorders. Usually there are some recommendations where non-medical interventions might help. This is drinking two glasses of water in the morning, which might help with getting the fluidity of the blood a little bit better. Second, doing some physical exercise in either breathing or moving around. It might be 3 minutes, it might be 7 minutes, but it should be done consistently over weeks. The third one is then having a healthy breakfast with lots of vitamins and berries and antioxidants. Other recommendations consider touching the area around the penis, which is the perineum, the inner thighs, and the area above the pubic bone. Then there are recommendations of eating healthy, drinking healthy, doing lots of sports, which certainly will help the physical fitness and might also help with erectile dysfunction. Interestingly enough, masturbation itself, which should activate the blood flow around or in the penis, doesn't seem to be very helpful, except in cases where there is a psychological feeling that the penis doesn't work, and then people might find that it does. Right, then there is recommendations about taking specific ingredients or specific vitamins in combinations or in isolation, but there is no clear evidence that it helps. There is lots of anecdotal evidence showing people who have a history of erectile dysfunction trying A, B, or C, and it's getting better, and usually takes 15 to 20 minutes for the doctor who tells these stories to come up with any of these recommendations. So healthy living is important. It's also important that you get your bloods and also your heart, lungs, maybe liver and your blood flow checked by the GP. So severe cardial problems can cause erectile dysfunction, and other things to be checked is for diabetes. Diabetes can certainly affect the blood flow. So healthy living it might also help in general. So there's nothing wrong having a diet with lots of vitamins and little fat and little cholesterol, but this is usually doing good for the whole body, and it's not very specific for erectile dysfunction, even though this might get better. If you have any experience or know better, please mention this in the comments. Thanks for your interest, and have a nice day and a nice evening. Thank you.